The truth about diabetic retinopathy and its link to diabetes. Today we focus on 3 cutting-edge treatments to stop the progression of this issue affecting our sight. Diabetic retinopathy is a complication of diabetes that affects the eyes. It occurs when high blood sugar levels damage the blood vessels in the retina, which is the light-sensitive tissue at the back of the eye. There are 2 main types of diabetic retinopathy. Non-proliferative diabetic retinopathy, NPDR. In this early stage, small blood vessels in the retina leak fluid or blood, causing the retina to swell or form deposits called exudates. Vision may not be affected at this stage, but it can progress to more severe stages. Proliferative diabetic retinopathy, PDR. In this advanced stage, new blood vessels grow on the surface of the retina or into the vitreous gel, which can lead to severe vision problems. These new blood vessels are fragile and can bleed, leading to scar tissue formation and potentially causing retinal detachment and vision loss. Diabetic retinopathy often progresses without symptoms in the early stages, which is why regular eye exams are crucial for people with diabetes. As the condition advances, symptoms may include blurry or distorted vision, floaters, spots or dark strings in the field of vision, and difficulty seeing at night. Now, as we diabetics all know, the best thing we can do to ward off future problems is to keep slim, eat healthy, control our blood sugars, and keep blood pressure under control. Okay, here is the rub. We may have heard about retinopathy when we were first diagnosed as type 1 diabetic, but speaking for myself, at the age of 24, I was overwhelmed thinking about this whole new change to my life. I knew job 1 was to maintain a healthy HbA1c level. But the bottom line is that most people aren't thinking about retinal damage the way they are thinking about checking blood sugar and what they can have for a meal that won't upset the whole process. Well, today's video is strictly about the latest treatment for diabetic retinopathy. I want to focus on 3 unique therapies. But first, will you support this channel by hitting the like and subscribe buttons? We thank you for your help in getting our content to an ever wider audience. Now, let's tackle these therapy options one by one. Photocoagulation. This laser treatment, also known as focal laser treatment, can stop or slow the leakage of blood and fluid in the eye. During the procedure, leaks from abnormal blood vessels are treated with laser burns. Focal laser treatment is usually done in your doctor's office or eye clinic in a single session. It's convenient and painless. Anti-vegf injections, intravitreal injections of antivascular endothelial growth factor (VEGF) drugs such as bevacizumab, ranibizumab, and aflibercept have been widely used to treat diabetic retinopathy and age-related macular degeneration. These drugs help reduce abnormal blood vessel growth and leakage. This treatment has shown great promise for patients, and as time goes by, the procedure is becoming more refined and more common. Retinal gene therapy. Emerging therapies involve the use of gene therapy to address the genetic components of certain retinal diseases. This area of research is continually evolving. Gene therapy controls diabetic eye disease for at least a year, according to an article by MedPage Today. This clinical trial was recently reviewed and the results were very encouraging. The gene therapy was associated with a substantially reduced risk of vision-threatening events, VTEs, said Mark Burricate, MD, of Retinal Consultants of Arizona in Phoenix, at the American Academy of Ophthalmology annual meeting. So, there we have it. As we have discovered in many videos this channel has offered, the issues related to type 1 diabetes, whether treating the disease or finding the complete cure one day, seem to rest in the development of gene therapy. This is very exciting, knowing that so much clinical research is focused on this angle of attack. As always, this channel seeks to find the latest news that impacts our friends around the globe suffering from type 1 diabetes. Thanks for watching and look for upcoming videos in the days ahead. Bye for now.